Hey guys, this is FixerMed. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 46 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at the sphincters of the urethra. The internal urethral sphincter, composed of smooth muscle, is located in the neck of the bladder and is controlled by the sympathetic nervous system. The external urethral sphincter consists of skeletal muscle fibers, encircles the membranous portion of the urethra, and is innervated by the perineal branch of the pudendal nerve. Let's next take a look at hydrocele and hematocele. A hydrocele or hematocele can develop in the tunica vaginalis testis or other remnants of the processus vaginalis. When performing transillumination, a hydrocele will produce a reddish glow, whereas other scrotal masses such as a hematocele, solid tumor, or herniated bowel will not allow light to pass through. Let's next take a look at cryptorchism. Cryptorchism, or undescended testes, occurs when the testes do not descend into the scrotum, a process that typically completes within 3 months after birth. The undescended testes may be located in the abdominal cavity or the inguinal canal. If left untreated, there is a risk of malignant transformation in the undescended testis. Note, in cases of cryptorchism, spermatogenesis is halted and the spermatogenic tissue is damaged, potentially resulting in permanent sterility in bilateral cases. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 35-year-old male presents to the clinic with complaints of urinary incontinence. On examination, his perineal reflexes are intact, but there is notable weakness in voluntary contraction of the pelvic floor muscles. Imaging studies reveal no abnormalities in the bladder or urethra. Which structure is most likely compromised in this patient? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, external urethral sphincter. The external urethral sphincter is composed of skeletal muscle fibers and surrounds the membranous part of the urethra. It is under voluntary control and is innervated by the perineal branch of the pudendal nerve. Weakness in the voluntary contraction of the pelvic floor muscles indicates a problem with the external urethral sphincter, leading to urinary incontinence. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, internal urethral sphincter. This sphincter is made of smooth muscle and is located at the neck of the bladder, controlled by the sympathetic nervous system. Dysfunction in this sphincter typically affects the involuntary control of urine flow, but it is not associated with voluntary muscle contraction weakness. C, detrusor muscle. This smooth muscle surrounds the bladder and is responsible for contracting to expel urine. Problems with the detrusor muscle typically result in symptoms like urinary retention or overactive bladder, not weakness in voluntary contraction. D, ureter. The ureters are responsible for transporting urine from the kidneys to the bladder. They are not involved in the control of urination or associated with the symptoms described. E, bladder neck. The bladder neck contains the internal urethral sphincter and is involved in the involuntary control of urine flow. Issues here would not explain weakness in voluntary muscle contraction or the patient's specific presentation of incontinence. All right, now that we have covered this question, let's move on to look at the next question. A 28-year-old male presents to the clinic with painless swelling of his left scrotum, which he first noticed 2 weeks ago. Physical examination reveals a soft, non-tender mass. Transillumination of the scrotum shows a reddish glow. What is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is A, hydrocele. A hydrocele is an accumulation of fluid within the tunica vaginalis of the testis or along the spermatic cord. It is typically painless and soft to palpation. When the scrotum is transilluminated, a hydrocele produces a characteristic reddish glow as light passes through the fluid-filled sac. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B, hematocele. This is a collection of blood within the tunica vaginalis, often resulting from trauma. Unlike a hydrocele, a hematocele does not transilluminate, as blood is opaque to light. C, inguinal hernia. This condition involves the protrusion of abdominal contents through the inguinal canal into the scrotum. It usually presents with a mass that may be reducible and is often accompanied by discomfort or pain, not typically producing a glow on transillumination. D, testicular tumor. Testicular tumors are usually solid and do not transilluminate. They are often firm and may be associated with a dull ache or heavy sensation in the scrotum. E, epididymitis. This inflammation of the epididymis often causes pain and swelling in the scrotum, typically presenting with tenderness to palpation and sometimes fever. It does not produce a glow on transillumination. All right, now that we have covered this question, let's move on to look at the next question. A 6-year-old boy is brought to the pediatric clinic for a routine checkup. The mother reports that he has never had his testicles descend into the scrotum. Physical examination confirms the absence of both testes in the scrotal sac. The physician notes that the testes are palpable in the inguinal canal. What is the most significant long-term complication if this condition remains untreated? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, infertility. Cryptorchidism or undescended testes, if untreated, can lead to impaired spermatogenesis due to the higher abdominal temperature compared to the scrotal sac, ultimately resulting in infertility. This is particularly significant in bilateral cases, where both testes are affected. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, testicular torsion. While undescended testes are at an increased risk of torsion, this is not the most significant long-term complication compared to infertility. Testicular torsion is an acute emergency rather than a chronic issue. C, urinary incontinence. This condition is unrelated to the position of the testes. Urinary incontinence is typically associated with issues in the urinary tract or nervous system, not with cryptorchidism. D, hernia. Although inguinal hernias can be associated with undescended testes, they are not the most significant long-term complication. Hernias can occur independently and are treatable conditions. E, prostatitis. This inflammation of the prostate gland is not directly related to cryptorchidism. Prostatitis usually affects older men and has no direct link to undescended testes. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.